Good afternoon, everyone. My name is Andrew Rowe, and today I'll be discussing one of the most pressing issues in the United States today: substance use and its impact on both public health and law enforcement. We've all heard about the dangers of drugs and alcohol, but what many people don't realize is just how interconnected these problems are, and how they shape everything from healthcare systems to community safety. My goal today is to inform you about the current trends in drug and alcohol use, the challenges faced by law enforcement and public health professionals, and how collaboration between these fields can help protect our communities. Let's start with the scale of the problem. In 2023, over 100,000 Americans died from drug overdoses, more deaths than those caused by car crashes and gun violence combined. We think of car accidents or shootings. We usually imagine major social issues that demand attention. Yet overdose deaths now surpass both of them quietly and consistently. This tells us something important. The drugs crisis isn't just about illegal activity. It's a public health emergency that affects families, schools, hospitals, and every level of society. Public health and law enforcement are deeply linked, and that connection is essential for achieving community safety. Public health professionals focus on prevention and education. Law enforcement handles control, response, and community protection. If these two groups don't collaborate, efforts can overlap. Can overlap. They can waste resources, or they can even work against each other. The relationship flows both ways. Health policies affect law enforcement, and law enforcement affects community health. This balance between them determines how safe and healthy a community becomes. Now let's look at the public health side. According to a 2023 study by Jones and the colleagues in JAMA Network Open, opioid-related deaths increased dramatically during and after the COVID-19 pandemic. Before 2020, about 50,000 people died each year from opioid overdoses. But as the lockdowns began, unemployment rose and treatment centers closed. That number spiked to nearly 80,000 in 2021 and over 95,000 in 2023. This steady increase shows that the problem didn't stop when the pandemic ended. Limited access to health care, mental health struggles, and the spread of synthetic drugs like fentanyl have all kept overdose deaths high. This isn't just a drug problem. It's a public health system issue that affects both individuals and communities. While drugs often dominate the headlines, alcohol misuse quietly harms millions of people, especially young adults. A 2023 study by Hajar and colleagues found a direct connection between alcohol use, poor academic performance, and increased dropout risk. The more frequently students drank, the higher the grades dropped, the more likely they were to leave school early. This may sound like a law enforcement issue at first, but think about it. Dropping out increases unemployment and risky behavior and long-term substance dependence. So even something as socially accepted as alcohol can have serious consequences that ripple into public safety and community stability. On the other hand, law enforcement faces growing challenges from synthetic opioids like fentanyl. Fentanyl is up to 50 times more potent than heroin, and even small accidental exposure can be deadly. Officers responding to overdose calls often deal with unpredictable environments, and community members who may need more medical treatment rather than just being arrested. This puts law enforcement in a dual role, protecting the public safety while also acting as a first responder in health emergencies. It's a complex balance, enforcing law while also saving lives. Law enforcement, public health, and community safety are all connected. When officers carry Naxalon to reverse overdoses or respond to addiction-related emergencies, they're taking on a role that bridges both safety and healthcare. It's a clear sign that solving the drug crisis requires both sides to work together. So how can we respond more effectively? The answer lies in collaboration. When police, healthcare providers, and community organizations share information and resources, they can better target prevention, treatment, and education. For example, some cities now have data sharing systems that alert officers and hospitals when overdose clusters are occurring, which allows for faster intervention. Community-based prevention programs like youth outreach and education campaigns also reduce long-term drug use. These strategies show how that prevention isn't just a slogan; it's an active, ongoing process that requires teamwork. Despite how overwhelming this issue can seem, this is a reason for hope. Cities that have embraced cooperation between public health and law enforcement have already seen improvements. For instance, areas that use overdose flow up items, where officers and healthcare workers check with overdose survivors, um, report fewer repeat overdoses and more people entering treatment. Data driven partnerships and community engagement make real differences. It's just not about punishment, it's about prevention and recovery. In conclusion, drugs and alcohol continue to challenge both public health and law enforcement. But by understanding their shared impact, we can take meaningful steps towards safer communities. Every statistic represents a person, a family, a story, a potential figure. By treating addiction as both a healthcare issue and a safety issue, we are acknowledging the full scope of the problem and the shared responsibility to address it. As we move forward, the collaboration between public health professionals, law enforcement, and community members will remain the most powerful tool we can have. Thank you for your time and attention.